Good afternoon, everyone. Welcome to our Facebook Live talk today, where we will be discussing about a rather interesting topic, that is, does all knee pain require surgery? Stay in and let us find out more together. Firstly, allow me to introduce myself. My name is Michelle. I'm a physiotherapist at Assunta Hospital, and I will be the moderator for today's session. Thank you for joining us, and I hope you are safe wherever you are during this COVID-19 pandemic. It's my pleasure to have Dr. Chee Eng Keong with me today. He is a consultant orthopedic surgeon on board in Assunta Hospital. He obtained his medical doctor MD degree from University Kebangsaan Malaysia, UKM, in 1998. He then pursued his master's in orthopedic surgery training from University Malaya Medical Center, UMMC. In 2009, he joined the arthroplasty program by the Malaysian Ministry of Health and specialized in management of knee and hip joint disease and total knee and hip joint replacement. He also studied the minimally invasive and computer navigations of total knee replacement and unique compartmental knee replacement, where he did his fellowship at Prince Charles Hospital, Brisbane, Australia, and Samsung Medical Center, Seoul, Korea. Dr. Chee Eng Keong is an orthopedic surgeon since 2007 and has a wide experience in managing general orthopedic work, which includes trauma surgery in adults and pediatric, hand surgery, diabetic foot management, as well as spinal surgery. So here's a little reminder before I hand over the next part of the session to our speaker today. If you have any questions during the talk, feel free to drop your questions into the comment box below. I will bring up the questions during the Q&A section, and they will be answered by our speaker later on. Also, don't forget to like and share our live video with your friends and family so they can also join us in this live session. Now, let us welcome our speaker today, Dr. Chee Eng Keong, on the topic, does all knee pain require surgery? Please, Dr. Chee.
Thank you, Michelle, for your kind introduction. So my topic actually is a series of topics on the knee pain in the elderly. The first topic today we are talking about is does all knee pain require surgery? As we know, we encounter a lot of elderly patients after experiencing knee pain. They might think of they need a knee surgery or knee replacement surgery. And the problem is the fear is so intense that they are reluctant to come and see doctors because of the possibility of knee surgery. But do all knee pain require surgery? The answer is no, because this is not always the case. Why? As we know, not all knee pains are at severe or end-stage osteoarthritis that need surgery. And a lot of time we need to consider other causes of the knee pain. Although knee pain, the commonest cause of elderly knee pain is knee osteoarthritis. Knee osteoarthritis is a condition in which the knee cartilage underwent wear and tear. And as you can see, the normal cartilage is like an enamel over our teeth, is covering our bone. If there's a wear and tear, there will be breakage of the cartilage and there's a less protective over the knee. And when you walk, there will be a knee pain and causing discomfort. What is cartilage? Cartilage actually is a resilient and smooth elastic tissue. It's rubber-like that pad over and cover the protect the end of the long bones at the joint. So it acts as a protection or a barrier. So when you have knee osteoarthritis, there will be a thinning of the cartilage. The thinning of the cartilage is a spectrum. It can range from mild, moderate to severe. In clinical, normally we classify it as stages from stage 1, 2, 3 to 4. So stage 1 is basically you will see the X-ray. This is our X-ray classification. From the X-ray, you will see just basically a normal knee, but you have some pain. Stage 2, you can see the inner knee part. Here you can see some thinning of the cartilage. Okay. When you come to stage 3, the thinning of the cartilage or narrowing of the joint become more severe, and there are also sometimes you can see these are commonly people say bone spurs or we call it osteophyte. When you reach the end stage, you will see the bone is touching the bone. So when the bone is touching the bone, it will cause even more pain and deformity. So the surgery normally is needed when you are at the stage 4 or end stage, where there's a bone on bone. So in other words, the knee pain might not be just due to the end stage of the knee osteoarthritis. There are always other causes of knee pain. The knee pain can be due to various stages of osteoarthritis at the early stages, and sometimes you can cause knee effusion or swelling of the knee, or even some bone bruise. Okay. Knee pain can be due to overuse. Sometimes you do runnings, do excessive exercise, that can cause some knee pain, which is temporary. People can have knee pain. The knee pain can be due to tendinitis or even bursitis. But other causes of knee pain can even, if you have a hip pain or hip problem, the pain can radiate down to the knee and causing a pain. Or you have a spine problem, the pain can radiate down from the spine to the knee and causing a knee pain. So how you differentiate all this? To differentiate, sometimes you need a thorough checkup and history and some examination. So it's better you consult your orthopedic doctors to ascertain all this. So normally when you visit a doctor's, first thing normally we will take a history regarding your knee. We will examine you and do an X-ray. So history, a lot of time, the duration of the pain is important. How long is the pain? When you get it, is there an injury? Nature of the pain, is it related to the movement? When you wake up, the pain is more, the pain is early in the morning, or is it pain related to any squatting activity? And history of injury are also important. That will tell us if you have any injury to the knee. On examination, normally we look for few things. One is swelling. Of course, you have pain. Sometimes there is a swelling. Swelling will tell us that your knee might be effusion or there's water inside your knee. Any deformity, because those knee pain that is chronic, sometimes with some time the erosion, you will have deformity. Deformity means out of alignment. Like this picture show there's a varus deformity or it's a bow leg. This is a common scenario in severe knee osteoarthritis. Some people might present it with the other spectrum, which is not knee. This is part of the osteoarthritis condition also. Of course, we will see the range of movement because a lot of time when you have knee pain, because of the pain, you can't move your knee. So you will have less range of movement. After the examination, a lot of time you might need an X-ray. As simple as a knee X-ray, we show how bad is the situation of the knee, and we can look for other causes of the knee pain as well. If we cannot find any causes from the knee, sometimes we might do a hip X-ray because, as you remember just now, I mentioned hip problem can radiate to the knee and then cause a knee pain. So hip X-ray sometimes is done to look for any arthritis changes as well. Knee pain can be due to the spine. If we cannot find all these things, sometimes we might need to do an X-ray of the spine or even an MRI of the spine. So only those patients with end-stage knee osteoarthritis, stage 4, severe deformity, and the pain is not relieved by conventional method, then you need to consider surgery. Okay? So this picture shows the varus knee or bow leg, which is severe, and the X-ray show the bone-on-bone deformity. And if you are not at the stage of the severe knee pain end stage, most of the time, you might just need some analgesic or pain relief medicine. Pain relief medicine can be ranged from very mild one, from paracetamol to NSAIDs, steroidal. Sometimes you just need some rest to relieve the pain. And cold therapy is a important thing. Sometimes you have a severe swelling of the knee. Ice pack will help to relieve the knee pain. A lot of time you can seek a treatment from the physiotherapy. Physiotherapy will do some treatment on your knee to relieve the pain. For those knee that is swelling, effusion, sometimes the doctors might suggest you to do an aspiration. Aspiration is a procedure that we stick a needle into your knee joint and aspirate the swelling inside the knee. This procedure actually will relieve the pressure inside your knee and it will relieve the knee pain as well. And a lot of time, crutches is important to offload the knee if you have any bony bruise. So in the summary, as we know, not all knee pain needs surgery. This is always the myth that all people have. They have knee pain, immediately they need a surgery, and they don't come forward for treatment. And a lot of time we need to consider other causes of knee pain before you need a surgery. For those knee that only reach any stage of the osteoarthritis, only you need to consider a surgery. Thank you. Any question?
Thank you, Dr. Chee, for the interesting and informative talk. Now we know that not all types of knee pain require surgery, so please consult a doctor if you experience any knee pain for further management. Looks like there are quite a number of questions from our viewers. So let's start the Q&A section, shall we, Dr. Chee?
Yeah.
So the first question will be from Miss Rachel. She was asking that does the knee OA runs in the family history, doctor?
Knee OA actually in certain group of patients they do run in the families, especially from the African descendant. But a lot of time it's a part of the wear and tear changes everybody have. So basically, in certain group only it runs in the family.
Certain group.
Yeah.
Okay, thank you, Dr. Chee. The next question will be from Muhammad Sujat. He was asking that does a knee injury on younger days cause the knee pain later in old age?
Yes, if you have a severe knee injury that involves like ligament injury, meniscus injury, it will make your knee more unstable. And if you over times actually those will actually age your knee faster. So if you have a ligament injury, you have knee instability, you need to address those instability in early stage. Don't let your knee to be like unstable for a long time. So that will actually accelerate the wear and tear of your knee.
Okay, thank you, Dr. Chee. So before we go on to the next questions, for all who are with us live today, you may still submit your questions in the comment box below and do keep the questions coming. Okay, the next question is from Jukamate. He was asking, does the weight affect the knee?
Of course, actually the weight do affect the knee because higher BMI actually your knee will look the knee will work more. So actually there's scientific evidence that show that if you have a higher BMI or higher weight, actually your knee will wear and tear faster.
Thank you, Dr. Chee. The next question is from Mr. Kalong. He was asking that what supplement is beneficial to knee pain?
Actually, supplement is a market normally in terms of glucosamine or chondroitin to help the knee in a certain aspect. Uh, they will, uh, however, all those things actually is not the key because it will do help you in a few percent advantage, but you need to consider the how much you use it also. So when those supplement build up your cartilage, but if there's wear and tear is faster than it can produce, you still have a wear and tear of the knee. So normally in the market, supplements are in terms of glucosamine and chondroitin. They do help a little bit on your knee.
Okay, thank you, Dr. Chee. The next question is from MF Sia. She was asking that your opinion about PRP, does it really helps to grow the cartilage?
Okay, PRP is we extract the platelet from our blood. Actually, platelet contain a lot of growth factors. Is actually do help in terms of degeneration or regenerations of the knee cartilage, but it's just to a certain extent only. It's not like for the full blown. Sometimes it might not work as well. So it's just an adjunct sometimes for the knee osteoarthritis treatment.
Okay, thank you, doctor. The next question is from Lee Jun Lim. She was asking when do we choose total knee replacement versus unipolar hemiarthroplasty for the patient?
Okay, knee replacement actually is done over the knee. Uh, that is for knee osteoarthritis. Bipolar and the other one is hip replacement.
Unipolar hemiarthroplasty.
Bipolar actually is done over the hip for the hip. Unicondylar knee replacement is done for the knee. But unicondylar knee replacement have a normally strict criteria. You must have your ligament intact, and then the knee osteoarthritis must be in an earlier stage. Is actually more feasible to be done. But the key is still the ligament. You must have the intact anterior cruciate ligament to entitle you to do a unicondylar knee replacement.
Thank you, Dr. Chi. Next question is from Ting Wan Ching. She was asking that knee replacement surgery can have how many percent of the success rate? Because some of the patients still experience knee pain after the knee replacement surgery.
Yeah, knee replacement actually do have a success rate of more than 90%. More than 90%. Of course, the knee pain sometimes the key thing is you have a reduction of the pain up to 90%. The complication probably range from 2 to 3%. So, of course, those the patients still have the knee pain, but they fall on the 2 to 3%. And sometimes other causes do contribute to the knee pain also. A lot of them, they have knee osteoarthritis, they have hip or spine problem as well. So sometimes we need to look into that. Is that other factors that contribute to the knee pain even after the total knee replacement?
Thank you, Dr. Chi. The next question is from Yap Lai Yin. She was saying that her father-in-law has been suffering OA for many years, but doctor is not recommend him to go for the total knee replacement because of the pain level is not reaching up to 10. So he said he have to bear the pain until he can't bear it anymore. Why?
Okay, actually we don't wait for the knee pain level reach until 10 to decide the knee surgery. As long as the pain is actually affect your daily activity, your functional activity, and then match with the X-ray show severe knee osteoarthritis, actually you can do a knee replacement surgery. So don't wait until the knee pain become very severe because when you are waiting, actually you are trying to compensate, and by compensating, sometimes they walk with a lurching, they are swaying. Those will affect other structures of the body. Example is like our spine. So actually, as long as the pain sometimes affect your daily activity, see, affect your sleep, okay, then his X-ray shows severe enough, then he should consider going for a knee replacement surgery.
Thank you, doctor. The next question is from Rachel Lee. She was asking that what is minimally invasive kneecap surgery compared to normal kneecap surgery?
Okay, minimally invasive classically is referred to the length of the incision, normally less than 8 centimeters, considered minimally invasive. But in actual sense, it's actually the knee surgery that is done with a proper soft tissue. We should respect the soft tissue. It should consider a good surgery already. It's just referred to the length of the scar only sometimes.
Okay, thank you, doctor. The next question is from the Hemavati. She was having a knee osteoarthritis, but no pain in the hip, but pain in the knee on and off. What should I do, doctor?
Okay, a lot of time you want to see, like just now I say, from the history, do you have an injury before? How long is the pain? And normally we need to examine you, how bad is the knee, and we do an X-ray. So actually, it's advisable to seek an orthopedic doctor's opinion to see what is the cause first, because normally we need to know what is the cause to go further for the treatment.
Okay, thank you, Dr. Chee. Next question is from Deng Yi An. She was asking about the treatment for the stage 2 knee OA, doctor.
Stage 2 knee osteoarthritis is considered mild to moderate stage of osteoarthritis. A lot of time we see what is the condition. Sometimes you have acute pain. Acute pain, you have a lot of pain, swelling, edema. In that stage, analgesic or painkiller might help. You need to rest your knee. You can put ice pack. Sometimes your knee will swell up also because of the inflammation. Then sometimes we will consider aspiration. After the acute stage is settled, sometimes you still have a background pain. Then you can consider injection of a HA or hyaluronic acid. PRP is one of the options as well. At the same time, physiotherapy will help because we need a strong muscles to support your knee. So regular exercise, physiotherapy to strengthen your knee muscles will help. So that will actually slow down your progress of the knee osteoarthritis.
Okay, thank you, doctor. Next question is from Andy Lai. He was asking that he's having knee osteoarthritis symptoms include the crack sound when he's running.
Of course, a lot of people think knee cracking is part of the knee osteoarthritis, but a lot of time when we see patients with osteoarthritis, that might not be the only symptoms. Knee cracking sometimes can be just due to some inflammations of the tendons or the structures around the knee. So when you move over the inflamed structures, then it produces some sound. So it is not necessary you have a severe osteoarthritis. A lot of time we need to do other tests like X-ray and all those things to determine it.
Okay, thank you, Dr. Chee. The last question is from Miss Kalong. He was asking, does raining on wet day causes knee pain in the elderly, doctor?
Yes, if it do affect, because if your knee cartilage or the padding over your knee is thinning down, so that will be your knee are more sensitive. It's just like your teeth, you got the layer is thinning down, you're more sensitive. So a lot of elderly patients, when they have arthritis, they are more sensitive to the cold environment. Probably because of the thinning of the cartilage. So they will feel it when raining or when wet days.
Okay, thank you, Dr. Chee. So, in the interest of time, I'm afraid that we won't be able to address any more questions. Thank you for keeping the questions coming. We will answer the rest of the questions by replying to your comments. Well, we have reached the end of our live talk today. Thank you once again to our speaker, Dr. Chee, for the talk.
Thank you,
and thank you all for staying here with us throughout the session. And I hope you have benefited from this talk as much as I do. Stay safe, take care, and bye-bye.
Bye-bye.